One of the most common questions that patients ask me is, where does low back pain come from? The simple answer is that low back pain comes from when there's a postural or a structural problem in the low back that puts stress on the nerves, and that stress on the nerve causes the pain. So when we talk about low back pain, we're commonly talking about the change in the posture, the change in the structure. So what's normal posture? Normal posture, if we're looking at it from the front view, we should be straight this way. But if you're looking at it from the side view, the spine is built to have these slow sweeping curves. A neck curve like this, a mid-back curve like this, and a low back curve like that. And the low back curve is the foundation of these three curves. Now, these three curves give us a shock absorber. Why do we need a shock absorber? To manage the effect of gravity, because gravity is constantly compressing us. So if we have that shock absorber, then we can handle that compression. Let's look at it from with a dry spine here. If you look from the front view, we should be straight like this, and from the side view, these are what these curves look like. Let's get this guy straightened out here. So we get a curve in the low back like that, a mid-back curve, and a neck curve. And that's what gives us that all-important shock absorber. When the spine's like this, the structure's upright, the posture's strong, and most importantly, it's able to protect these delicate nerves. Now, the way that the nerve system works is the brain sends strength and energy down the spinal cord, out each of these nerves to all the different parts of our body. And then the body uses that strength and information, and then it sends signals back up to the brain in this communication loop from brain to body and body to brain is how we stay healthy. Now, the nerves are the only system, the only organ in the body that's protected in its own bony shell. And it's in the spinal cord, which is really the lifeline of the nerve system, is protected in the spinal bone. But this is the key. The spinal bones will only protect it if they're in normal posture or alignment. So if our posture misaligns out of its normal position, then that misalignment puts stress on these delicate nerves. These nerves don't like to be compressed, they don't like to be twisted, and they don't like to be stretched, because those stresses on the nerves will cause nerve irritation, which can lead to pain if it hits a pain-sensitive nerve. All right, let's take an example. My posture is supposed to be upright and straight this way. Let's say I had some kind of a stress, a trauma, an injury that caused my posture to misalign. So the posture comes out of place. That misalignment causes stress causes inflammation, just like if you twisted your finger or if you twisted an ankle, that joint would swell. Well, when it happens in the spine, that swelling compresses those delicate nerves. Well, what would we do about it if the spine was misaligned? We have specific techniques to correct that posture. Let's say the posture's misaligned like this. We could do a therapeutic exercise to push it towards center. So if they're shifted like this in their misalignment, we could do a therapeutic exercise to correct it. We could create an adjustment from the chiropractor to push it back into place. We could do an in-office or a home traction to pull it over. The first thing we have to do is figure out exactly what the misalignment is. What is the postural deviation? And that postural deviation, that misalignment, we evaluate that with either a photographic study, a chiropractic examination, or an x-ray, or all three of them. So we see exactly what the misalignment is. Then we come up, based upon that specific misalignment, we come up with strategies for the patient to work on in office and home to actually get a correction. And if you fix the posture, it takes the stress off the nerves, so then the body can heal and the low back pain goes away.